Afternoon and good evening to all of the wonderful people out here in Zoom land. My name is Dr. Deirdre Young, and I'll be serving as your moderator tonight. We would like to just thank you and welcome all of you for the Tour for Diversity in Medicine and our panel tonight. We are a grassroots effort organization here to educate, to inspire, and advise future minority healthcare professionals with terminal degrees. T4D seeks to bring pre-health enrichment activities to campuses that house and screens of potential future minority health professionals. We have visited 27 states, and typically HBCUs, Hispanic serving institutions, and community colleges across our wonderful states of America. T4D provides groups of unexposed students the chance to learn and meet with visiting physicians, dentists, and pharmacists, as well as medical students at their home institutions and without any financial burden. Having expanded significantly through virtual platforms, T4D provides initial and honest exposure to careers in the medical field, as well as opportunities for their educational and professional advancement. We are excited for you all to join the Healthcare Professional Week every year to share our diverse perspectives and experiences. We have some wonderful panelists with us today, and I'm going to give them a moment to introduce themselves. I'm going to have them tell us their name, their chosen field, and their current role in institution. Let's start with Dr. Tyree Winters.
Hi, good afternoon, everyone. I'm Dr. Tyree Winters. I am a board-certified pediatrician by training, as well as I did training in obesity medicine. I am currently the Pediatric Residency Program Director at Goriep Children's Hospital in Morristown, New Jersey, and happy to be here.
Thank you so much, Dr. Winters. Let's go to Dr. Michael Campbell.
Good evening, everybody. My name is Dr. Michael Campbell. I'm a board-certified ambulatory care pharmacist, currently with Mayo Clinic, working in a family medicine capacity, supporting physicians with medication therapy management services.
All right. Thank you so much, Dr. Campbell. Let's go to Dr. Chavez.
My name is Janelle Chavez. I am currently a medical student at Stanford University. I'm in my 4th year out of 5. I'm doing a journalism fellowship about health media, and I'm excited to be here today.
Outstanding. Well, thank you all for joining us. Again, we have all different perspectives at all levels, and we are just can't wait to engage with you all today. So let's start with Dr. Campbell. What made you choose your field? And did you consider any other options?
Yeah, great question. So my mother and grandmother are nurses, and they somewhat steered me into healthcare, but I didn't really have a passion for nursing. They then tried to steer me into medicine, and I don't remember why. It was a long time. I'm an older pharmacist now. I have gray in my beard. I didn't really want to be a physician. So when they asked me, well, what about pharmacy? That intrigued me because I didn't know what pharmacists did. So I asked them, and they wouldn't tell me the answer, and they made me research it. And upon doing that research, I fell in love with the idea of being a pharmacist before I even really knew what that entailed. And here I am today, 18 years later, practicing at Mayo Clinic as a pharmacist.
Wow. Well, we are glad to have you there. I know that's an important location, important work that you're doing. What about you, Dr. Winters? Tell me, what made you choose your field? And what else did you consider? I know you have an interesting story.
So it's very interesting because Dr. Campbell and I share some similar points as well. So I always wanted to be a pediatrician ever since I was 5 years old. And I had a phenomenal Black pediatrician who was a graduate of Howard University School of Medicine. Actually almost 50 years to the date that I graduated from medical school. And she was just a great inspiration and resource. But as I was fortunate enough in high school to be able to be a part of a program where I was able to become a pharmacy technician. I actually started to have a love of pharmacy, which led me to enter into University of Michigan School of Pharmacy. Within the first semester, I realized I really wanted to go to medical school. So I actually left pharmacy school, took a went back to the undergraduate school at University of Michigan to finish my degree. And then during that time period, applied to medical school with 28 days to sit for the MCAT to be able to apply for that year. Needless to say, I was blessed enough to be able to get in on my first try. However, the best part of that process was that I really have gained and still maintain a great respect for all of the healthcare professionals that I work with, including our advanced practice practitioners, our physical therapists, our social workers, etc.
Okay. All right, student Dr. Chavez, what made you even want to go to medical school? Did you consider anything else before going to medical school? Let's hear about it.
Yeah, I think for me, medicine was always very interesting. I loved science. I did well in school and I thought that was really interesting. And I grew up around my 4 grandparents who were all older and lived in my small town. And I think I saw a lot of their health issues. And just for as long as I can remember, we were always talking about medicine, always talking about health. It just seemed so important. And I thought that the work that doctors did was very important. I was drawn to that. And then I think on a bigger scale, I'm from South Texas by the border. It's a rural area, not a lot of doctors. And then I just saw a lot of issues, a lot of obesity, diabetes, cancer, and not a lot of people there practicing. So I thought medicine is so important. There are a lot of issues that not only I can help on a one-on-one level, like I've seen great doctors do for my grandparents, but I can try to help like society and try to fix the area that I grew up in. And I thought it was just an amazing career that you could do a lot of things that's intellectually interesting, and then you can really help people. And then for things I considered, I mean, I used to say in another life I'd be a journalist, and now I guess I'm doing both. Stanford has a program where you can do global health media. So I'll actually be at CNN for interning in January to March. So I think like medicine's amazing. Like you can do, I think it fits in so seamlessly. You can be a doctor, but still be able to talk about science and communicate. I also thought about being a teacher, but I think because I come from a family of teachers, but I think you can teach your patients so many things. You can teach students one day as a doctor. So I think even within medicine, I'm able to satisfy a lot of things. And I think there are many opportunities to do other things that are interesting.
Absolutely. As Dr. Winters knows, I can relate to everyone's story. I originally had planned to first be a math teacher and then a pediatrician, and I ended up in pediatric dentistry. So I just love oral health. I love this connection, and I love just working with other healthcare providers to really kind of put the patient in the center and really to be of service. I'm specifically from Detroit, Michigan area, and it was just an alarming number of, I should say, lack of pediatric dentists in the area who were servicing our youth, our young people. And, when I think about chronic absenteeism, in elementary schools, it's asthma and dental caries. And so why aren't kids learning? Well, partly because of healthcare access issues. So how can we address that and make sure that children have the opportunities to just see where they want to go, and seats in the, butts in the seats, and learning and just being able to be in a safe place. And all of us are playing roles in that. So I thank each of you for what you do and what you espouse to do. All right. Dr. Winters, tell me what you're most proud of as it relates to your field of practice. What are you most proud of?
I'm most proud of being able to be an example, and also to be able to relate and be a part of the families of the patients that I take care of. I think one of the things that drew me into pediatrics, as well as to be able to serve in the primary care role, is the ability for us to be able to be a part of someone's lives. It's a great privilege as well as responsibility to take care of someone's child, to take care of someone's life.
That's right.
And because of that great privilege and responsibility, it also is something that I don't take lightly. So even the fact of being invited to one of my patients' first birthday party, and they made us shirts, and one of the shirts that I had, the shirt that I had said "Doctor of a King," and I thought that was one of the things that really made me like almost tear up, because it was like, man, I'm a part of someone's life. And when you think about it at the end of the day and you add up how many hours of face-to-face time you may spend in a patient's life, especially for pediatrics, it's about maybe 24 to 48 hours total if you accumulate all of the in face-to-face time. But yet and still, if I ask anyone, do you remember your pediatrician, or you remember the doctor or provider that took care of you as a child, everyone resoundingly usually says yes. So imagine that great privilege you have of being that influential in someone's life.
Absolutely. Hey, Dr. Campbell, if you had to go back to high school, can you think of a helpful thing that your counselor said, like the most helpful thing, and maybe the opposite, the least helpful thing that was shared with you?
Oh man. I
I
think
know you
that,
got grace. So we got to think way, way back,
yeah,
right?
that's a loaded question. I think that the best way to answer it was to really reiterate that being a minority applicant in a health professional academia, we don't really have a lot of mentors to go to, or counseling available. So you kind of have to journey through the application phase and searching through your identity as a matriculating healthcare professional alone. So a lot of it came from peers, and a lot of it was negative because they don't have the perception of a pharmacist that looks like me or them. So you
That's
get a
right.
lot of negative feedback that could stymie your progression. So having to overcome those hurdles and identify pharmacists and physicians and other healthcare professionals that look like me that could give me feedback on how to move forward with that. It was a lot of negativity I had to combat with.
Okay. What about you, student Dr. Chavez? Excellent high school counselor advice and the worst. Did you have that?
Definitely. I can remember my counselor advised me to apply to different colleges and for scholarships. I'm from a very small town in South Texas. I thought I would go to school somewhere close by down there. I thought about going to the University of Texas, but to me it seemed so massive, so huge, so expensive. And I didn't know of any scholarships that existed for the school, so kind of put it out of my mind. But my counselor told me about a scholarship that existed called the 40 Acre Scholarship, which is a full ride scholarship. And so I applied. I didn't think, I was like, oh my gosh, they only pick those like 20 in the class. Who am I to apply? But he encouraged me to do it. And then I got the scholarship. So that allowed me to go to college at the University of Texas at Austin, which was life-changing, opened my world. And I'm so grateful that someone encouraged me to dream bigger and to go up and apply for something. And I would just encourage other students to, aim high, Google scholarships for the schools that you're interested, whether that's through this university or outside. Things exist. And there's a lot of opportunity no matter where you all come from. And they're really looking for students from diverse backgrounds to go to these places. So that was really great. That was one big, huge, life-changing thing that someone saw me and said I should apply. And then least helpful, maybe, I feel like maybe just didn't give that much help. And maybe I didn't use the resources enough at my high school to ask counselors about college, things like that. So I mostly got a lot of my information from like the College Board, and I would look up like how to become a doctor. The College Board has a lot of helpful advice for like pre-health professionals, things like this, like these sort of webinars, hearing PATs from physicians. I didn't have anyone in my family before do the PAT, so to me it was all kind of confusing. So I would just recommend using the counselors at your school, and then using the internet and getting as much information as possible so that you're well prepared when you go to college to make the next step.
Absolutely. You know, preparation is key to life. So, you know, making sure that you get the access, prepare, ask the questions. It may not even be the right questions, but it can lead you to getting the right information. So just putting yourself out there, that's super important. So Dr. Winters, what did you study in undergrad? And how did that actually help you prepare for your life in the health professions schooling?
So I initially started off as a biology major and quickly realized after biology 101 that I do not like biology. And I was so, which was interestingly enough, I actually started biology. I took biology my sophomore year, even though I was a biology major. I took chemistry and physics first, and I loved chemistry. I even took organic chemistry in high school and took organic chemistry over the summer. So it was like really my thing. And then when I got to biology, I was like, oh my God, I hate this. Why am I majoring in this? And so I was very fortunate enough at the time when I was going through biology 1 and biology 2, by that time I had pledged my fraternity, Alpha Phi Alpha Fraternity Incorporated. And because of that, one of my big brothers had educated me and said, you know, you don't have to go into biology in order to go into any health profession school, whether it's pharmacy, medicine, or anything. You can major in anything that you like. And funny thing is that my father had told me at the time when I was first starting off in college not to pick a humanities course. He was like, pick psychology. You'll really love psychology. I really enjoyed it. And when I did psychology, I fell in love with it. So I actually majored in psychology. I changed my major literally, I want to say within that week, to psychology after I talked with my frat brother. And from that point on, I had took so many psychology and sociology classes that I was able to get a minor in sociology. So I'm a sociology graduate.
And I can imagine that background has helped you tremendously in the work that you do now. And what a great information. Do something that's going to make you happy. Obviously, we have to take our prerequisites for all of our high school students. Prerequisites just simply means there are certain courses you have to take in order to apply to medical school, pharmacy school, dental school, medical school, all the schools, right? These health profession schools. So we call them prerequisites. And we find often that students will probably just major in that because they're going to take those classes anyway. But then there are the students that don't. And Dr. Winters is a great example of a student that didn't, but still ended up both at a pharmacy program and then also in a medical school. So clearly, to balance that.
I was also going to add in as well, one of the beautiful things about psychology is that we do a lot of development in psychology. And I use that on a day-to-day basis in pediatrics because one of the big parts of pediatrics is thinking about the way that children develop. So my undergraduate degree definitely came into play when it regards to my current career.
Outstanding. What about you, Dr. Campbell? What did you study in undergrad, and how do you feel that helped to prepare you for a health profession school?
I think that the class that I loved the most or gravitated to the most was undergraduate chemistry.
Oh, I'm a chemistry major. Let's go.
Yeah, I wouldn't call myself a chemistry major, and I'll get to that story in a little bit, but the undergraduate component of it where I just fell in love with starting with the periodic table. And then when we look at drugs today, a lot of those are comprised of that. So when I got into medicinal chemistry in pharmacy school in a graduate program, I started to excel in it. But it was because I had a passion for chemistry at an elementary level, like seeing that in high school and junior college, at the University of Arizona in Tucson. But when I didn't get into pharmacy school the first time I applied, right out of junior college, I had to choose a major at U of A in Tucson, and I chose biochemistry, but I didn't really have a passion for it. So I was just going through the motions, not really excelling in it, doing well in the curriculum. So I think that the passion for what you're studying can really invigorate you to do well in it. So when I got into pharmacy school and took medicinal chemistry, which was more difficult than the biochem I was studying in undergrad, I started to excel in that as well. So that was my favorite subject. It still is today. And I rely on a lot of those principles when I discuss medications with patients and my residents and student learners.
Okay. Student Dr. Chavez, can you tell me about what you majored in undergrad and how is it helping you now as you finish up at Stanford?
So I did major in biology, the pretty standard medical pre-med track, because I did find biology really interesting, and I think it overlapped a lot with the pre-med requisites. And I found that the upper level courses like human physiology, immunology were really interesting to me, microbiology. So I would recommend that when you start to look at your major, think about not just like the basic subject, but when you go further down, when you're 2-3 years in, what does that look like? And do you think you'll enjoy those classes? So I really did. And my school also offered a pre-health professional certificate. So that required taking language courses. So I was able to take a few Spanish courses, which I kind of grew up speaking Spanish, but having like the formal education is really helpful. And now as a medical student, I speak Spanish all the time, especially out here in California, which is super helpful. And I think that'll be really invaluable if you can, as a student, to be taking language classes. The certificate also required you taking ethics classes, psychology, sociology, things that are not outside of just the basic sciences to be a well-rounded doctor. Like the other panelists were saying, I think it's really important to have that. So that's what I studied, and I think that it prepared me well for when I was entering medical school.
Outstanding. Since you're talking, and you're probably the closest to this question, tell us about the application process. So what's required? And where do you find some of your colleagues, where did they actually underestimate or even miscalculated what really needed to be done? We'll love to hear from you.
Yeah, so when I think about the application process, I think the first two main requirements, the two big things I think about GPA and MCAT. Those are things that you can control, especially when you start college. So to me, those were a priority. I guess GPA, I just took a lot of my classes seriously. I tried to do my very best to learn as much as I could, but also I knew that would be important, like 3 years down the road when I applied as a junior. So I'd focus on that. The other big thing is the MCAT, which is the big test. I don't know what it stands for, but it's kind of like basically the SAT, ACT for medical school. So I took like a semester in college while I was studying. I took a pretty light load, and then on the side I was studying specifically for medical college admissions test. So I was studying on the side of that to prepare for that. So I took several months for the MCAT, and that was kind of a big thing. So I wouldn't underestimate but your college courses and the MCAT. But like I said, your classes in college will prepare you for the MCAT. So just take academics seriously. Aside from that, I think things that you can do to stand out from other students that are all going to have baseline scores are things like research, getting involved at your university or outside at hospitals or summer programs. I did a summer program in Houston at UT Houston, and that was really great. I think extracurricular activities are really great too. Volunteering in your local area is really helpful. I was also in a club, a global medical training, where we volunteered in the Dominican Republic and Peru. And that was like the first time I had been outside of the US, aside from like Mexico, growing up, because I was close, and it was really mind-blowing. But also we were able to help a lot of people. We got a lot of donations and gave them to clinics and worked with local doctors in the area. And those were things that I was able to talk about a lot in my personal statement when I applied to college and even in interviews. So I'd say like definitely focus on your studies, enjoy college, but have the academics a priority if you're thinking about applying to one of these schools. And then outside, like research, extracurriculars, any activities, volunteering, service that you can do that are important for applications, but also just as a person to help you be a well-rounded doctor. I think those are the main things. I know it's a lot to think about, especially when you're just starting college.
Thank you. Dr. Campbell, what do you think? What are the things that people kind of underestimated during their application process? that you can recall?
I think that a lot of students try to do some or a little of everything that's listed on the admissions committee's website. And what I found through my own process and mentoring younger students as they gain admissions to graduate school is that if you do a few things, but you do them well, like volunteer at the same organization for an extended period of time, that for an example, as a pharmacist, you don't need to volunteer at a hospital and work in a pharmacy. What I did was I worked in a pharmacy and I volunteered at a community center in my community that for children, underserved children, helping with homework. And I did that for the 2 years prior to getting in the pharmacy school. So when I got a letter of recommendation that said, hey, I've known Michael for 2 years in this capacity, it's better than 4 letters of recommendation that say, hey, I supervised Michael for 3 months. To the admissions committee, it's more important to show that longevity and consistency.
As I couldn't agree more. Sitting on the several admissions boards at this point, I can tell you clearly that it is more important to have substantial experience and volunteerism as opposed to giving out turkeys one day, 3 months later, doing a triathlon activity where you're volunteering one day to help the kids, experience, and then doing this other thing. We're looking for a profound connection, right? So 2 years is a profound amount of time to tutor young people who are in underserved areas. So Dr. Campbell, what a great information to give to our future doctors, physicians, and dentists and healthcare providers here seeking terminal degrees. Dr. Winters, you can go either way with this. I know you've done interviews. I know you've been on the opposite side of this. So any advice? What do people underestimate in your experience?
Yeah, I think they underestimate that there is this mystical barrier between themselves and the admissions committee or the director of admissions. I think one of the biggest, and you can appreciate this, Dr. Young, as well, one of the biggest advocates that you can have is the director of admissions. If you actually reach out to the admissions office of a school that you may be interested in, say for instance, if your institution, your undergraduate institution have a graduate program, or there's a graduate program you really are interested in, being able to reach out to the admissions office saying like, hey, can I speak with the director of admissions, have an appointment with them, or even a counselor, whoever have you. It provides, one, that relationship that will help guide you. Is not necessarily that it's a shoe-in to get in, but it really connects who you are as a person to the application. And they can also help to steer you away or steer you towards some more beneficial activities to do or things that will help to propel your application. So prime example, when I have, as a residency program director, when I have candidates for medical school that reach out to me and say, hey, I'm really interested in your residency program. Can I have a conversation with you? It's great because I can get a chance to talk to them and say like, hey, what are you thinking about with this? To both Dr. Campbell and Dr. Chavez's points would be, if you are necessarily thinking about academics, and I know that you may have had a period of time where your academics may have faltered a little bit, I can always say, well, hey, you may want to think about taking this extra course, or you may want to consider, think about like, hey, you may have not did as best in your beginning, but you really show progress at the end. That's great. That this is showing that you took this information, or you took some portion of why I didn't necessarily do as well, and you learned from it. And I want you to highlight that in your application. Or to Dr. Campbell's point, if you are saying like, oh, I'm doing this and this and this and this and this and this and this, the same way Dr. Campbell just gave you that wonderful advice to maybe pull back a little bit, that admissions counselor, that director of admissions can also say, you may want to try to focus in on a more profound or a more substantial volunteer sort. Gosh, I'm
Yeah,
getting tongue-tied today. Thank you. This is like the 13th time that I've been tongue-tied today, so thank you. You get
no
what I'm trying to say, Dr.
because we're wearing many hats and we're juggling many balls, and it was very important to kind of keep them all up, and that's what we're here. We're here to support and make sure caught your ball, ready to keep it moving. So, Dr. Campbell, what I'm hearing from Dr. Winters is that it's important to reach out. What else? Let's talk about networking. Let's talk about connecting. Let's talk about reaching out and follow up. Can you talk a little bit about networking and following up?
Um, from an applicant's capacity, or okay, so I think that it's very important to not forget where you started your journey or where you fell in love with the profession you want to enter into, but having an understanding that the people that are around you at that point in time are not going to travel with you along that journey or reach you at your destination. So surrounding yourself with positive people and mentors in your
Yes.
field, it's really important. That it's a huge commitment and burden sometimes being a pharmacist, a dentist, a physician, a podiatrist, working in healthcare in general, a nurse, a social worker. So it's not appropriate to enter that field without speaking to as many of them as possible and identifying a mentor in that field that can guide you through some of the barriers so that you don't have to journey through that process alone. So in order to do that, I tell students these days, you have networks at your fingertips. LinkedIn, you can access any type of dentist, any type of culturally appropriate pharmacist. You can find mentors that look like you and message 10 of them in 10 minutes. Whereas when I was doing it, I had to walk in to a Walgreens in my community over and over 20 times, different locations, and not see anybody that looked like me and get discouraged. But that small scope in one zip code isn't all encompassing. There's thousands of pharmacists that could have helped me that students have access to now. So using your social networks appropriately.
That's powerful. Go to LinkedIn and just inbox 10. I mean, one of them's probably going to reply, especially when they see your picture and see that you're a real pre-health student, right? I mean, yes, I know I would. That's
I mean, how many of us as professionals now get a barrage of messages? Hey, I'm recruiting pharmacists or physicians or dentists like you. If I saw, a student do that, which I've never had. I've never had a student say, hey, can I talk to you about this? I'd be enamored with that idea because it's something new and fresh. And I took an oath as a pharmacist to impact the next generation of pharmacists. And that's really the most rewarding part of my profession. So I would encourage students to do that. They can do that today, immediately.
Janelle Chavez. Let's talk about follow-up. So someone wrote you a letter of recommendation. Someone said they'll mentor you. You got busy in medical school. Is that an excuse not to reach back out to the people that helped you get where you are now? And though you're busy, what could you do to keep that relationship going?
Yeah, that's a great point. I mean, as soon as after they write letters for me, I send a thank you. If I get the award or get into the school that I want to get that they wrote a letter for, I'll send something to, like, update, good news, something like that. As a medical student, it's hard, but I think it goes a long way to just send like an email every so often, sharing your updates, how life is going, connecting with coffee or anything every so often. I think that's really helpful. And
in my experience, my mentors have been very understanding. I can go several months without being in contact, but then I think every time I reach out, they're so willing to help, and they understand how busy it is. And then so that was the first part, was about mentors,
Yeah.
and how to stay in contact. Yeah, I think that's the main thing. Oh, another thing I wanted to add is that I've stayed in contact with a physician that I started shadowing in high school, who's like the son of my substitute teacher, and she was like, you should shadow him. So I did, and he was one of the first, like the first doctor I'd ever shadowed. And even in college, when I would go home for winter break, would make like one morning to go shadow him. Every time I was home, not every time, but I would be there for a summer, and I would go check in and shadow. He's my grandma's doctor too, so I saw him recently this summer, and I think it's huge. So just doing things like that, connecting with those people. He was able to write me a letter of recommendation for this fellowship that I applied to last year, and someone who had known me for like 6+ years was able to say something about me and my character. So I think long-term relationships are great. Stay in contact even with people that you start with from like high school. I think those are really valuable mentorships.
Absolutely, absolutely. Going back, and I want to go back to you again on this one because you're so close to it. What's the one piece of advice you wish someone would have given to you when you were going through the application process? What's that thing like, man, I wish someone would have said that to me. That would have made this so much easier. You can give us two if you have two.
Yeah, I'm trying to think. I mean, maybe mentors, that's one like practical thing. Like you are going to have letters of recommendation written about you for medical school or for whatever pre-health professional school professional school you apply to. And I went to a massive university, like 50,000 students. My chemistry class had like 500 students. So that wasn't really something I started thinking about until like junior year when I was ready to apply. I thought, oh my gosh, what professors know me personally well enough to write a letter about me when I've been in classes with several hundred students? So that was something that I think I would have loved to think about from the beginning. There were some professors that I could think of that I had been to office hours several times, or did well in their classes, and they were able to write letters for me. But that was something that I got advice from a student a year above me, but I got it like in the third quarter, my third year, and I was like, oh man. So I would just recommend just to think about that and be proactive about that. And then another thing, I think, just like why not me attitude, that's kind of like as I've gone through many applications in my life, I always get so nervous. I get so worried about like the future and like not having control. And I think like every time you're gonna be where you need to be. And also, why not you? Like people are gonna be accepted to these schools, these programs. And I wish I would have had more self-confidence in myself when I was going through these applications, to go up for these different schools and these programs, and just not be afraid of rejection, because it could lead to something really great. So that's something that I wish that I had embraced as a high school student, and especially in college too. And then I encourage like just go for all these different applications and then just see what happens.
Okay, Dr. Winters, what about you? What's that one piece of advice you wish someone would have told you when you applied to medical school?
That there is no straight paths. I think it is so important to know that just because someone else may have had one path or another person may have had a different path, your path is what's meant for you. And I think that we get so caught up. I remember because I took that departure between medical school and pharmacy school, that it pushed me back a year. And I was so freaked out and worried about like, oh my God, I'm going to be behind a year. I'm going to be behind a year.
Yes.
Now moving forward and being, just telling somebody, being almost 20 years from the time that I first entered into medical school, I can tell you like that year has come and gone, and who knows where it is. And I think that's so important. So even when I hear sometimes high school folks or folks from college that will say like, oh my gosh, but it takes so long and it's so like it's so difficult. And I always think to myself, like, unless you plan on dying anytime soon, you have time. You have time to be to do whatever you want to do. So I think that's the one thing I would say.
All right, Dr. Campbell, what's that one thing you wish someone would have said?
To make fiscally responsible decisions before you enter graduate school. And if you're unaware of what fiscally responsible means, start to educate yourself on that matter, because it's something that if you're coming from an underprivileged or an opportunity constricted environment, and you become a healthcare professional and start to have fiscal resources, it goes back to those people you start with. If they see you elevate and they don't, that could compromise resources that you've worked hard to attain. And then you need to manage that well, because again, it's hard being a healthcare professional, and you don't want that component of your life to be a struggle, because it'll make it difficult for you to take care of yourself. And if you have a family one day, those other individuals that rely on you, because you spend so much time learning about healthcare that you don't learn about finances. And with healthcare comes higher wages, and if you mismanage them, it could lead to more burnout, and you won't be a sufficient healthcare provider.
Absolutely, absolutely. What great advice. I can look back at mine. This was pre-COVID, obviously, when I went to interviews. And so I applied to all these schools and I got the interviews, and guess what? I had to fly to go interview. Now, I am from a opportunity-stricken area, and let's just say I didn't have access to go fly to where all these lovely schools that wanted to interview me. So I had to narrow this down to 4, okay? And 2 of them were in the state that I live, and I was able to organize my interview to happen around the holiday season so I could still be interviewed. But guess what? They already accepted a portion of their class by the time I interviewed, but that was the only time I could afford to go back to go interview. So please be mindful of that. I will say some schools have little small funds to help you get where you need to go for an interview. It's really important to contact, like Dr. Winters said, the director of admissions, as well as the director of diversity and inclusion. Most of the schools now have offices dedicated to diversity, equity, and inclusion. Please let them know what's going on, and don't be embarrassed about your situation. There are waivers out there for the MCAT, for the DAT, for all these entrance exams. They waive not just the fee, but they waive application fees, they waive supplemental application fees, and they may even give you transportation to go to your interview, or set you up with a virtual option now that we have schools are doing that as well. So talk to people, let them know what's going on, share your story. Thinking about sharing your story, and we'll probably end with this question. I'm going to ask everyone just to share a little bit about their story. I know we got some of the high level things, but what's probably one of those influential moments in your life as it relates to medical school, pharmacy school, and all the other schools that really let you know you could do this. You can keep going. You could strive and go even further than what you even expected. Let's go with student Dr. Chavez.
Yeah, that's a tough question. Oh my gosh. I think, I don't know. I mean, I feel like I've been surprised at every stage of my education. Like, if you had told me in high school that I would be here at Stanford as a medical student, I would not have believed it. Like, not in my wildest dreams. People, like, I just had, it was crazy. It was never on my radar. It wasn't even much of a dream of mine. I didn't really have a plan. I just knew I wanted to be a doctor. I wanted to help people one day. So I would just say, like, just go with the journey, just do your best, and then everything will fall into place. Don't stress too much about the end outcome, because like I said, I couldn't have dreamt this. This is amazing. And then moments that keep me going, I think, like the patients as a medical student, it's really, really hard. Sometimes the hours are crazy. You're working for free, you're getting evaluated. It's really tough sometimes. But then you have those patient encounters where it's just so meaningful. Like the other panelists were saying earlier, it's just such a privilege and an honor to be in the room when people are going through really difficult times, when they're going through really happy times. And I think that's kind of what always brings me back, reminds me why I went into medicine in the first place. So just find that now, find something, whether it's a service opportunity, whether it's like a family member of yours going through something that reminds you why the career that you want to go into is so important and so inspiring and exciting. And I think for me, that's what has kept me going throughout the years.
Okay. What about you, Dr. Winters? What's that thing? What's that story that you want to share with us today?
Yeah, so it was a very great story. So what wound up happening is that I, just similar to Dr. Young and the rest of us who are part of this tour, we have gone and spoken to so many students and have gone on and mentored so many individuals. And prior to even my experience with the tour, there was a student that I mentored who I shared a lot about my story. I have had experiences very similar to Dr. Chavez when it comes time to having family members who dealt with health issues. And I shared stories about struggles that I've had with my parents who both were ill during my time in training, whether it was in medical school or even in residency. And when I shared this story to a group of pre-meds that were trying to enter into medical school, I was able to see one of those pre-meds who were just feeling ready to finish medical school. And she talked a lot about her, when she started medical school, her mom had developed Parkinson's disease very early on, and just how hearing my story helped her so much. And it came during a time when I was just at my wit's end. I was very tired. It was a lot that was going on. Sometimes, I can't lie to you, this can seem like a thankless job, but to have that, to have her pour into me and tell me, like, because of you, I was able to persevere and move forward. That was just everything that I need to refill my cup again. And I really appreciated that. So it's just knowing that you'll be surprised at the test that you're going through can be somebody else's, it can be the testimony that helps someone else.
Thank you so much. Dr. Campbell, what's your story you want to share with us today with all of the young people that'll be watching us?
I'm sure there's probably a lot of minority and underserved viewers we have tonight and students that'll be applying soon. I just want to say that it's okay to look at those as a barrier, but you have to embrace those. When I walked in to the first day of class in 2009, out of 103 students, I was the only African-American pharmacy student in that class. And that was jarring to see, because that's when the imposter syndrome was birthed. Yes. And I saw a Black physician 3 years later on rotation in a hospital, and I told him that story, but he was nearing the end of his career. He went to medical school in a time where, people protested that he was there, and he told me, why don't you just embrace it? It's not going to help to complain it. You have to move forward. And these days, I'm at an institution that was never built to take care of patients that look like me, let alone have people that look like me take care of their patients. And when I got here, I met a physician that looked like me, who had a patient who was 90 years old that looked like us. She was African American. And when this physician and pharmacist walked in the room at Mayo Clinic, a place she knows wasn't built for her to exist or get care in, and that her practitioners looked like her, she started to cry. And a lot of the visit was, she was just telling us how proud she was that she had the opportunity to even be in our presence, and we took care of her as if we would anybody else. But other patients aren't going to understand that dynamic the way that she did. So for the students who are on the call today who feel like they're disadvantaged, embrace that, because your patients are also disadvantaged, and one day you can impact them in that manner as well.
Absolutely. Well, I just want to pause and just say thank you for all three of you sharing your story with us today. Lots of wisdom, lots of openness, and your passion is very clear. It just jumps out of the Zoom screen. And just continue to do what you do. Fight the good fight, spread the good word, and encourage our young people and encourage me and all of us, because your stories actually just encouraged me as well. I'm going to keep doing what I do and just being present and letting everyone know you belong here. When you go into that big auditorium and you're one of whatever, that seat is yours. You earned it. You belong there. You look to your left, look to your right, and then get your iPhone out or whatever phone you have. Look in the photo, look in the mirror, look at yourself. Look at yourself. You belong here. Okay? And say it to yourself and live in that. It is yours. The time is yours and the opportunity is yours. Grab it, keep a hold to it. So friends, we're going to say, hold for a second while I let Dr. Darko come in as we prepare for our next panel discussion. Follow us on Twitter, Instagram, Facebook. Please go to our YouTube station as well as our website to see more information, more panels, more scholarship opportunities, and just more of us as we share our story. Thank you for sharing space with us. Have a great night, everyone.
Thank you, Dr. Young.